Hello, everyone, and welcome back to History of Medicine. I hope you're all doing well. This week in class, we're going to focus on medicine in medieval Europe. Our specific focus will be on women's medicine, specifically an influential medieval text called the Trotula. Said to have been written by a 12th century female doctor from Italy, the Trotula has received lots of attention over the last few decades. Though the text has been around for centuries, it was really only in the 1970s that historians started paying attention to it. The reason for this, largely, was that the 1970s was a time marked by the rise of women's history, of feminist approaches to historical inquiry, and of more general scholarly interest in things like gender, sexuality, and women's lived experiences. As such, before we get to talking about either the Trotula or medieval European medicine, I want to set us up for this by talking about trends within the profession of academic history since the 1970s. In the first of this week's lectures, our questions will be of an historiographical nature and focus explicitly on the rise of women's history and of feminist approaches to scholarly research. As such, our questions for today are as follows. 1. How has feminism impacted the field of medical history since the 1970s? And 2. How have feminist approaches themselves to medical history changed over the years? So, to begin at the start. Up until quite recently, the history of medicine was a male-dominated field that either ignored women or presented them in very stereotypical ways. But in the 1970s, all of this started to change. The feminist movement of that decade was, in many ways, fueled by women's outrage at the medical profession, which was viewed as paternalistic and condescending, and which became the target of organizations like the Boston Women's Health Collective. Activists in this and other related groups were united by a common goal: the desire to improve women's healthcare and to end sexism in the medical system. More specifically, they battled against the medicalization of childbirth, the outlawing of midwives, and the criminalization of abortion. Much of the movement's energy was devoted to securing greater reproductive rights for women, and these efforts generally paid off, as can be seen when, in 1973, the U.S. Supreme Court handed down a decision in Roe v. Wade that legalized abortion. In many other ways, the women's health movement put questions about birth control and female autonomy in the birth process on the political agenda, and the effects of this movement rippled into academia in a very profound way. The women's health movement gave a huge boost to the discipline of women's history within academia. And from the beginning, questions of medicine and health were of central importance to this new field. Feminism encouraged historians to rethink the relationship between women and medicine. Whereas previously, scholarship emphasized doctors' contributions to women's health, early feminist accounts stressed women's subordination to male medical science. They did this by drawing attention to the ways that medical interventions had exploited women and to the sexual politics of sickness more generally. Early accounts looked at how doctors in the past stressed women's inherent weakness and emphasized their reproductive role over other kinds of non-domestic, non-family-related roles. Women here in these early feminist texts were presented as the victims of male medical control and misogyny. Two early examples of this literature were a pair of books by Barbara Ehrenreich, a biology PhD, and Deidre English, a journalist. The books were called Witches, Midwives, and Nurses, A History of Women Healers from 1972, and Complaints and Disorders, The Sexual Politics of Sickness, from 1973. The first of these books argued that since the Middle Ages, Western countries had increasingly restricted women's abilities to practice medicine while also increasingly controlling women's bodies. It argued for a golden age in the pre-modern world, where women practiced medicine and shared knowledge about their bodies freely. At a time in which women were battling against sexism in the healthcare field, this book offered evidence that women could once again take control over their bodies and be authorities in their own right in matters of health. A few years after this, Ehrenreich and English published a third book, which was called For Her Own Good, 2 Centuries of the Experts' Advice to Women. This book was about how doctors used pseudoscience to control women's bodies. Its historical examples included the argument that menstruation was a disease, that women seeking college degrees were endangering their reproductive systems, and that mothers were to blame for all kids who came out as gay. Critical of each of these ideas, Ehrenreich and English tried to show how medical science has historically been used to limit women's control over their own bodies. Today, women's historians regard these as poor examples of feminist scholarship. With the passage of time, the idea of a vast male conspiracy in medicine has faded. So too has the view that women in the past were simply the passive victims of male practitioners. Now, today, we have more studies that examine women's own roles in past medical debates about femininity and their bodies. Thus, the newer view is critical of the idea that women in the past existed only as passive victims of medicine. More thoughtful work puts beliefs about women's bodies in the context of medical theory and is much less damning than earlier work. Today, feminist historians have produced studies of childbirth, of gynecology and obstetrics, of birth control and contraception, of women doctors and nurses, of female patients, of prostitution, and of a variety of diseases that have historically been gendered feminine, for example, venereal diseases. Gender has been incorporated into many aspects of medical history. For example, the creation of gendered identities of medical practitioners, women's fight to join the medical profession, or gender differentials in the provision of healthcare. Thus, feminist contributions have significantly expanded both the scope and the scale of scholarly research into the history of medicine, and have enriched and enlivened the field in a way that no other development has. One of the central contributions of feminist theory to medical history is the idea that gender is not a stable, fixed, biological category of existence, but instead something that is constructed by sociocultural values operating in specific historical circumstances. That is to say, masculinity and femininity are separate from biological sex. One of the most influential arguments here came from the pen of Joan Scott, an historian whose 1986 article, Gender as a Useful Category of Historical Analysis, set forth the idea that gender is historically determined. Explaining gender as something defined by the meanings we give to our bodies, Scott approached gender through the lens of culture, looking at how legal, religious, philosophical, and medical texts influenced how gender was defined in the past. She attacked the idea that the concept of woman was a historically stable one. The project of separating sex from gender made it possible to see how women's and men's actions are shaped by something other than their biological status as males and females. At first, this theory seemed difficult to implement within medical history scholarship. As the historian of early America, Kathleen Brown, put it, quote, "Many of these approaches replace the search for stable, continuous, and univocal meanings with analyses of contestation, discontinuity, and dissonance. This work reflects a rejection of essentialism, the belief in a historical, transcendent core of experience and identity that is usually seen as derivative of the physical body, a project that many women's historians support in theory, but find difficult to achieve in practice. But, gradually, historians have come to use gender in the same way that they had been using class or race, that is, as one of the central axes along which power is distributed and contested. Just as was the case with class or race, gender came to be a way of understanding how medicine is laden with cultural assumptions, in particular, cultural assumptions about femininity and women. By rejecting rigid biological categories of male versus female, it became possible for historians to show how socioeconomic, cultural, and political forces informed definitions of female and male bodies. Much of this early scholarship, unfortunately, focused quite narrowly on the experiences of middle-class white women, whose experiences were seen as representative of those of all women. Since then, however, we've broadened the demographic scope and have begun to look at how other signifiers of identity, like race and class and sexuality, intersect with gender to produce different kinds of medical experiences for different kinds of women. So, putting this all together, we can say that feminist contributions to the history of medicine have encouraged 4 particular innovations. 1. Integrating women's experiences and the concept of gender into the history of medicine. 2. Exploring women's experiences as workers and professionals in healthcare, and understanding how they've coped with sexism and discrimination. 3. Critiquing medicine's ways of dealing with women's diseases, reproduction, sexuality, and healthcare needs. And 4. Deconstructing notions of neutrality and objectivity within medico-scientific writings. Feminist medical histories look at how medical texts define and frame femininity and masculinity. They talk about women's fight to join the healthcare profession and explore their agency as workers, consumers, and healthcare providers. They talk about the impact medicine has had on the construction of womanhood or on manhood and on representations of the female and male body. They look at the state's role in monitoring women's bodies. They ask about how sex and gender get biologized and definitions of normal and pathological with regard to women's health. All of these questions have encouraged a rather productive rethinking of the relationship between women and medicine, and medical history is all the better for it. Okay, now that you've had a chance to learn about the rise of women's history and feminist theory's contributions to medical history, I have some questions I'd like you to consider. These will serve as the point of departure for our discussions this week and are: 1. Is all medical knowledge gendered? 2. What impact does medicine have on our ideas about masculinity and femininity? 3. What do you think about the role feminist theory should play in the history of medicine? Once you've had a chance to think about these things, please head over to our discussion board and we'll get this conversation started.